Hi everyone, welcome to another Advanced Rheumatology Catching Up on the Couch. I'm Christine Matelan, your host, and joining me today is registered pharmacist Anne-Marie Rapone from Hyde Drugstore in Newcastle, Pennsylvania. Welcome,
Hi,
Anne-Marie.
Christine.
Today's topic is bioidentical hormone therapy. So, Anne-Marie, give us a little overview of what we'll be discussing today.
Okay, so bioidenticals must be, you receive your bioidenticals from a compounding pharmacy. They have to be made in a compounding pharmacy. And what that means is a compounding pharmacy makes customized prescription medication tailored to a patient's individual needs. Now, the hormones that we're going to be going over today are testosterone, progesterone, estriol, estradiol, and DHEA, which is a precursor to testosterone.
Okay. So, from my understanding, bioidenticals are pretty much natural plant sources. Is that correct?
Yes. So bioidentical hormones are derived from natural plant sources such as yams and soy. And when you use a bioidentical, they are the exacular molecular structure that your body recognizes. So I like to call it hormone restoration and not replacement because it's enhancing and restoring your natural hormones, as opposed to using a synthetic hormone, which is manufactured by the pharmaceutical companies. That is foreign to your body. It doesn't match the molecular structure. So essentially, if you use a synthetic hormone over time, your body starts to slow down its own production of its own hormones because it's being replaced by the synthetic.
Okay.
So that's why we're talking about the bioidenticals today.
Okay. So what about symptoms of perimenopause and menopause?
Sure. Okay, so perimenopause, when we talk about perimenopause, that is the time in your life leading up into menopause. That's when your menstrual cycles might start to become erratic. You might have 1 month where you have a very heavy cycle. You might have another month that you don't have a cycle at all. And at this point is when your hormones start to become imbalanced and they're starting to fluctuate. And I call this fluctuation almost a hormone hurricane because they're all over the place. And that's when you start experiencing symptoms going into menopause. Now, menopause is typically defined as 1 year without a menstrual cycle. During this time frame, some of the most common symptoms, we see women having hot flashes, anxiety, sleep disturbances, low libido, low energy, anxiety, moodiness, unwanted weight gain, and foggy thinking. Now, everybody's biochemistry is different, and not everybody experiences these symptoms, but most women do experience these common symptoms to some degree. And for my years, many years as a pharmacist, what I have seen over time is a lot of people has been prescribed anxiolytics, which are anti-anxiety medication, antidepressant, and sleeping aids, when essentially it could have possibly been a hormone imbalance.
Okay. So we talk a little bit about fixing these problems pretty much organically from plants instead of filling your body with more pills that are either over the counter or prescribed by your doctor. Can generally taking care of the either highs or lows of your hormones have any type of effect on your life expectancy?
Okay, so it's a good question. So as we look at life expectancy as in the past, people are generally, they're living longer. We're looking at going through perimenopause and menopause between the ages of 40 and 50. Life expectancy now, people are living into their 80s and some well into their 90s. So we're living a third of our lifespan in a menopausal state, in a hormone imbalance. And there are some consequences to your health for this because it could affect your overall health and your quality of life. And some of the top ones are increased arterial tone of the heart, which leads to hypertension. We're seeing hardening of the arteries, osteoarthritis. People are having a thinning of their bones. decline in thermoregulation of your body, which leads to the hot flashes and the night sweats, memory deficiency, and even a decreased immune response where you might notice that you're taking a little longer to recover from an illness. And HRT, the hormone restoration, has been proven to help prevent or slow down the progression of some of these disease states.
So, what are our long-term goals with getting everything back in sync, so to speak?
Okay, so when we start with hormone therapy, you want to start slow and low. And our goal is to be within a physiological dosing. So I heard an analogy once, and this really stuck, and I think this is a good one. Think when you're listening to a symphony, and it sounds so beautiful, and then the horn section is louder than the rest of the symphony. Everything is just off. It's the same thing with your body. Everything needs to be in harmony. For example, I had a patient who came and she was having chronic headaches. And we did a hormone saliva test, and her estrogen was way up here, way off the charts, not even on the chart. Her progesterone was down here. It's supposed to be like this. So we went ahead and her doctor prescribed the HRT therapy, and we gave her some progesterone, and we actually gave her some supplements to help her metabolize the estrogen, where she came to a normal level. And she's 3 months in now, and she was having migraines on the daily, and she's down to, she says, 2 a month maybe. Great. I'm not saying if you have headaches that this might be the cause of it, but I am saying this is a really good tool to utilize to get to the bottom of some of your health issues.
Okay, let's talk about the testing itself.
Okay, so there's different prescribers do it differently. Some do it from symptoms alone, which I think with symptoms alone that you may be running the risk of overshooting one hormone and not giving enough of the other, and you really can't see where your balance needs to be because it's symptoms alone. Now there's blood testing. When you test in the blood, your hormones in the blood are what they call protein bound. And what happens is your hormones are bound to this protein, which affects your tissues in uploading the hormone. So even though you might have a decent level in your serum testing, it's not a true reflection of what's actually available to the tissue and what your body is going to use. When you test saliva, it's not protein bound. So it gives you a better picture of what your body can actually utilize.
Okay. And for the saliva testing, how much saliva are we talking about a patient capturing for the test?
Well, it depends because there's three types of tests that we have. And so they all test all the hormones, like I stated previously, estradiol, estriol, testosterone, progesterone, and DHEA. But then we're also testing cortisol levels because adrenal health is very important with your hormones. So if you do one has a morning cortisol, second test is a morning and bedtime cortisol, and the third test is morning, noon, evening in bed to really give you a picture of your adrenal health. So if you do just the first test, it's 1 tube, and then if you go up to the 4-point cortisol, it's 4 tubes throughout the day.
Okay. What happens when the results come back? Are they sent to the physician or are they analyzed by yourself? Or
so what happens is you go through the test, okay, and the results will come back to me. Now, I did state that about the cortisol levels in adrenal health. I wanted to go back and talk about that a little bit because how important adrenal health is. Because in a perfect world, okay, when you get up in the morning, your cortisol should be very high, not very high, but it should be high to give you the energy to get through the day. And then as you start to unwind down your day, the cortisol level should go down. So some things to ask yourself with that are some symptoms of adrenal fatigue, and this is also part of the test. There's a questionnaire, and I can go over that as well. Are you drinking coffee all day to get through your day? Are you exhausted when you wake up no matter how much sleep you've had?
Okay.
Are you tired but wired? You just can't fall asleep at night. Are you getting your second wind by the end of the night? You're tired all day, and then at night maybe you want to start your laundry where you should be winding down and going to bed. Do you generally feel run down? So these are all signs that you might be in adrenal fatigue. And this is also assessed through the saliva testing because optimal health is key. You want the whole puzzle, just not a piece of the puzzle.
Right.
And if we find that your adrenals are off or abnormal, or if you're having these symptoms, then you might be put on a supplement, and which may be added to your hormone protocol, and such as, for example, an adaptogen. And what an adaptogen does, it adapts to stress. Everyday stressors that we have. Stressors can be emotional, it could be physical, it could be financial, it could be relationship. Everyday stress that we have affect adrenal health. And the adaptogen, if your cortisol is too high, it'll lower. If it's too low, it'll higher it. And it'll help your mood, it'll help your energy, it'll decrease anxiety, and just generally make you feel better.
Okay. Okay, so that was a great explanation on adrenal fatigue, Anne-Marie. This is
That's the actual kit.
For testing, and as you can see, it says hormone test kit, to be done at home, not necessarily in a physician's office. Can you explain a little bit more about
Sure.
the test itself?
That's what's so nice about it. You can do it at home. It's non-invasive. And the thing I like about the kit is you're going to get a questionnaire inside. And I tell patients, and it's a symptoms list, and you really want to think this out to give accurate answers. It's on a scale from 0 to 3, 0 being no symptoms, 3 being too severe. Because when you have these type of deficiencies, one hormone deficiency symptom may overlap another symptom.
Okay.
So what we do is we take all the symptoms and then it's categorized. And then we pair it up with your labs. And then we're able to pinpoint which direction to go with your treatment, because it goes off of symptoms and your labs to see what we want to use. So when you see this inside your kit, you really want to take your time. It asks you a little bit of your health information, if you're taking any supplements, when was your last menstrual cycle, if you still have a menstrual cycle. You want to take a minute, make sure that you thoroughly fill this out. It's very important. And then inside the kit, there's a mailer, a prepaid mailer, and there's your tubes that you need to fill up with your saliva. And you just put it all in the package, and it's prepaid. You pop it in the mail.
Okay.
And about 2 weeks later, the results will come back to the pharmacy. So then at that point, I call the patient and we discuss the results. And if the patient is a candidate for HRT, hormone therapy, then I will forward the labs to the doctor, and I will collaborate with the doctor with an appropriate protocol for an HRT therapy.
So you say takes about 2 weeks for the results to come back from the lab.
Yes.
And then I see that you have
I have a sample
test report to show to the audience of how detailed it is of everything that we're looking for.
It's very detailed. So here's our test report. This is a couple pages long. I've seen bigger, okay? And it tells you your estradiol, your progesterone. It tells you your progesterone estradiol balance, so we know where you are. Cortisol levels. Second page, I don't know if you can see this. It's one of my favorite pages. The second page here, these are graphs on where you should be. And I'll explain this when I call you. I will email you your lab, mail it however you want me to send it to you, so we can go through the report together, and I'll explain on how to interpret this. But if you look at the graphs, there's a black dot. That's where the patient would be on the chart. So I was explaining that patient earlier where she was having the migraines and her estrogen was off the chart. Her estrogen the dot was way up here, not even in the green. The other is the patient reported symptoms, and we can see what was reported as moderate or severe. And these symptoms are paired with the actual lab values here, so that we can come up with an appropriate protocol. And then just on the back are the lab comments, which when I make the phone call through you, I can go through that with you and explain what the conclusion of the report was.
Okay. Okay, so once a patient receives their results back, you yourself are going to take a look at them, schedule either a phone call, or do you do video or just audio with the patient?
Either or,
okay.
Whatever the patient prefers. We can do a video call. I can do it over a phone call.
Okay, and then you come up with a treatment plan.
Yes, if you're a candidate for HRT If your levels show that you would benefit from it, I come up with a treatment plan. I forward the lab results to the prescriber. I forward our patient consultation details to the prescriber so he or she sees the entire picture. And then I collaborate with them for an appropriate therapy.
Okay. What would be the best approach for the patient to obtain a kit? Would they talk to one of the providers here at Advanced Rheumatology or their PCP?
You just have to call me.
Just call you directly.
We stock them at the store, and we're in Newcastle, PA. You do not have to drive to Newcastle. We will ship them to you.
Okay. Now in our office, we do have information in the waiting area as well as in some of the exam rooms on the testing. You may see a pamphlet, something like this, scattered throughout, and basically it has Anne-Marie's information on the back, and it talks exactly about everything that she is going through in the topic today. So, Anne-Marie, you come up with a treatment plan for a patient. Obviously, you're going to be the one compounding what they need.
So we have we have an in-house lab at Hyde Drugstore, and we have a team of compounders, and we would compound your prescription medication, and we can ship it out to you. We service all of Pennsylvania.
Okay.
Now there are different dosage forms, okay, that they come in. So the most common is going to be a transdermal cream. So transdermal cream means that the active hormone, the active chemical, is put into a transdermal cream base. It's used topically, applied to the skin, and then it's absorbed into the bloodstream. Okay, so these are our transdermal creams. This is typically one of the ways that we dispense it. This is called a toppy click. And when you turn it on the bottom, one click is 0.25 grams. Now that's for us to figure out for you. But we will tell you on your prescription how many clicks you need. Some people need 1, 2, 3 clicks. When you apply this, the beauty of the toppy click, you're not touching it with your hands. You don't want the hormones on your hands. So you can apply this to the area without getting it on your hands. Basically, you want to apply it to thin skin for absorption. Your wrists, back of your knees, inner thighs. Sometimes we even apply this vaginally.
Okay.
The important thing with these topical creams is to rotate sites. You don't want to do the same site every day because you're going to overload the receptor site and it can affect absorption. So this is our toppy click. We also have transvaginal creams. So this is an example of a container that a transvaginal cream would come in. This is called a meter dose pen. Typically when women are prescribed testosterone vaginally, we use the pens. And these have a lock on them. You can unlock them in case it's in your purse, something hits against it, you want it to be locked, and you just press down and you can see. Okay, so that would be an accurate dose. That's why we use these devices for accurate dosing. Another would be we use, when you have an internally, we have our vaginal applicators, and the applicator is simply very simple. See, it's very simple. It screws on to the tube, and you would just press up the cream, and it would go to the dose that's marked on the applicator. These are your vaginal applicators. Now, in addition to the topical creams, we also do vaginal suppositories, and we do capsules. So an example of a capsule would be progesterone. Now, just to show that how everything is tailored to everybody's individual needs, let's say you have vasomotor symptoms. You're having hot flashes and night sweats. So you may be recommended a progesterone topical. Let's say you're having the same symptoms, hot flashes and night sweats, and you're not sleeping at night. You're tossing and turning, you can't sleep. We would not give you more than likely a topical progesterone. We would move more towards an oral progesterone, because oral progesterone creates a sedating effect where you can get a natural deep sleep without taking a sleeping medication. So just to show you how everything ties in there, everything's tailored, everything's looked at and tailored to the individual patient.
Okay. Is this test covered by insurance?
The saliva test is not covered by insurance.
Okay.
I do have patients that use their flexible savings account. With the tests, once again, you get the lab results, you get the consultation from the pharmacist, and you get the pharmacist forwarding it to your prescriber for consideration. We also, once we do a test for you, it doesn't stop there. So we do the test. You have to remember, when you do hormones, you want to start off slow and low. So you should expect results sometimes in a month. It could take up to 3 months. We are going to check on you, seeing how your symptoms are, because we do start off slow and slow, low and slow. And we might have to add something, okay? Or we might have to tweak it a little bit until we get to the desired where we need to be based off of symptoms at that point. And then within 6 to 8 months, I'm going to suggest another saliva test so we can compare to the baseline from when we started.
Okay.
And then typically after that, it's just a year, it's yearly. But when we do add, just so you know, say we wanted to add, progesterone to your topical estradiol, we can put in the same cream. So you're not applying 5 different creams. Okay. So we can combine them together. It gives you cost savings, and it's more convenient.
Okay, well, this was very interesting and very educational, and I think at some point it might be nice to revisit it again and talk about some other compounding things that you can offer our audience. So Anne-Marie can be contacted at Hyde Drugstore in Newcastle, and that phone number is?
Well, we're at 724-652-1451. And when you call, you would want to follow the prompts for compounding, and that'll put you right to the compounding department.
Okay. That does it for another episode of Catching Up on the Couch. I'd like to thank Anne-Marie Rapone from Hyde Drugstore in Newcastle for joining us and giving us a very great education in bioidentical hormone therapy. So once again, stay safe, and we'll see you again soon.